Well, it is definitely scary anytime you have to take your child to the emergency room. And of course, it is normal to be tense or concerned when doctors suggest medical tests to really find out what's going on. 6 News anchor Lori Tucker has much more on this in tonight's Caring for Our Kids.
Well, Kristen, experts say don't be afraid to ask a lot of questions. Of course, it is your child's health, so it's well worth it. Here to talk about some of the most common tests and procedures is Dr. Ryan Redmond, ER Director at Children's Hospital. Always good to see you.
Well, thank you.
First of all, what are some of the most common tests that children may need when they're brought to the ER?
Well, certainly, the doctors in the hospitals, we love our tests. So typically the things that people ask about are the blood work, urine tests, x-rays, things like that. Those are the biggest things that are most commonly ordered.
Let's talk more specifics about those. Let's begin with the blood test. What are some of the things you look for?
So one of the interesting things about taking care of kids is that a lot of the things that we kind of standardly look for in adults, the lab values are different. We always say kids are not little adults. So we're looking for different things in those tests than you do typically for adults. For instance, infection. Most people look at a CBC to tell the difference between a viral and bacterial infection. That's not very helpful in younger kids because their bone marrow is very reactive and they will have high white counts with viral infections. So you need to have someone who understands the difference between those test values and knows how to put that in a clinical picture with what's going on.
Interpretation. All right. What about the urine test? What are you looking for there oftentimes?
Most of the time we're looking for urinary tract infections. Becomes very important, especially in kids under 2 with fevers, because they can sometimes not show symptoms at all. But we can also tell things about how your kidneys are working and things like the presence of diabetes.
Okay. When my kids were little, I used to be kind of nervous about x-rays. Other than broken bones, what could an x-ray tell you, and should a parent be concerned about any harm those x-rays may cause?
That's always the right question to ask. Now, when we're talking about plain x-rays, it's a relatively small amount of radiation that we scale to the child, so it's something that we don't tend to worry about long-term effects for. Now, when you're talking about CT scans, which are kind of a combination of hundreds of x-rays in one exposure, it is something that you have to be mindful for, and it's always appropriate to ask if that test is really going to give you an answer that is worth that radiation exposure.
And that really goes for any type of procedure. If a parent has a question, a good doctor like you doesn't mind being asked about it.
Absolutely, and that's one of the most things that we like, is having an engaged parent who can ask, why are you doing this test, what are you looking for, and being able to have that discussion.
All right, anything else you'd like to add about this to ease parents' fears when they come to the ER? Because that is, as Kristen said, such a tense time, and obviously and understandably so.
Yeah, absolutely, and what we always try and emphasize is that, we understand that it's not looking for values on the lab test to just look for values, that we've got to have a reason, especially because a lot of times it involves some degree of distress and discomfort for the child. So we always say the most comfortable lab test is the one that doesn't need to be done. So having someone who knows the clinical picture and can oftentimes avoid those tests is a great thing.
All right, we'll leave it at that. Dr. Redmond, thank you so much.
Thank you.
Hope that was helpful to you parents. And if you have a question about your child's health, just send me an email, ltucker@wate.com. And be sure to tune in every Thursday here on 6 News at 5:30. We may use your question on the air. Kristen?